Having headaches about which birth control to choose? Want to have sexual relations without the fear of STIs or pregnancy? With the very real threat of pregnancies and STIs, there's some questions you need to consider before choosing your method of birth control. Are you and your partner monogamous, meaning it's just you and him or her having sex? Or are you having sex on a more casual basis with different partners? Those are things to consider before getting birth control. Another thing to consider is whether you want a birth control method that protects against STIs and pregnancy, or if you simply want to protect against pregnancy and use hormonal methods. Most importantly, you have to ensure you get a birth control method that fits your lifestyle and your needs, which is most important. The main objective of birth control is to prevent the sperm from fertilizing the egg and from the egg implanting into your uterus. However, when choosing a birth control method, you do need to consider whether you want a hormonal method, a barrier method, or an intrauterine device. The birth control pill is considered one of the most recognized methods of birth control. However, there are many choices for women to choose from. If in fact you already know which birth control method you want, and you opt on a hormonal method of birth control, and are in an exclusive relationship, you should definitely consider the Depo Provera. The Depo Provera is an injection hormonal method that helps to protect against pregnancies. The shot is administered by a healthcare provider and lasts for 12 weeks. You only have to return every 3 months to get another dose. The shot could be administered on the hip or the arm. Depo, or Depo Provera, is a highly effective form of birth control. The Depo-Provera works by inhibiting ovulation in the pituitary gland and thickening the cervical mucus, and also prevents the normal buildup of the endometrium. The Depo-Provera has a 0.2% failure rate, among the lowest. The rate takes into consideration that a woman comes back every 3 months. A grace period of 2 weeks exists between shots, allowing a woman to go without the worry of getting pregnant. Some of the advantages of the Depo Provera are its easiness of use, lighter periods you might get with it, and also how immediate it is in working. Some of the side effects of the Depo Provera are changes in your menstrual cycle, like spotting or breakthrough bleeding, things like headaches, abdominal pain, nervousness, tenderness in breast, depression, along with a decrease in sex drive. Another side effect of the Depo Provera is a cessation of a woman's period, meaning she no longer experiences the monthly menstrual cycle. Another side effect of the Depo Provera is a loss in bone density. The Depo Provera costs about $90 per 90-day injection, which comes up to $30 per month. Again, as a reminder, the Depo Provera does not cover any STIs, only pregnancy. The Depo Shot is only available through prescription. A healthcare provider needs to provide the injection and administer it. Many women can obtain the injection via their insurance, or others can go to free healthcare clinics. The state of California currently covers family planning services through a program called Family Pact. This program is available for low-income individuals or for individuals with a barrier of access to the services. The Depo Provera can prove to be the best option for many women. You just have to keep into consideration the positives and negatives, but ultimately it is your decision.